So in general, these are painless lumps in the body. They can occur from head to toe, so it really depends on where. However, oftentimes people will notice a slow-growing mass on an extremity like your thigh, and they will present to their primary care doctor just noticing this. If the primary care doctor has suspicion, they would then refer them to most likely a surgical specialist, depending on the site of the body. For instance, if they notice this in the head and neck region, they'd likely send them to an ENT surgeon or physician. If they noticed it in their thigh, they may send them to an orthopedic specialist. To diagnose any cancer, you typically need a biopsy. So before the diagnosis is established, they would undergo a form of biopsy to either confirm a sarcoma diagnosis or to confirm a benign diagnosis. The biopsies have evolved for soft tissue sarcoma. In the past, it might have been a more invasive procedure. Currently, most people are doing what we call a core needle biopsy, where they take a piece of the tissue out, which is typically done in the office and not done in the operating room. With that said, depending on where the mass is, it may require a more invasive biopsy, but that's a generalization. Once the biopsy is done, it's sent off to a pathologist who will look at it under the microscope. That process typically takes about a week or so, at which point the patient would return to that physician's office and go over the results of the biopsy. After the diagnosis of a soft tissue sarcoma is made, the next step is to perform imaging both of the tumor site and of the rest of the body to understand where there is or isn't disease. We take the diagnosis very seriously. Any cancer prognosis depends on the stage, on the patient's ability to receive treatment, and whether or not it's resectable or not, meaning it could come out surgically. And so, in general, when I'm treating patients with soft tissue sarcoma, I tell them this is a curable cancer and to focus on the treatment that you have to do at the moment, and whether that's get through surgery and recover or get through radiation. And our hope is that you'll have a great outcome long term.